here for your head to toe exam. Do you have your bladder empty?
Yes.
All right, we have you in your gown. We did your vital signs, which are all normal. And we had you do your Snellen's eye chart, which 20/20 in each eye, uncorrected, perfect vision. So that's really good. So we're gonna get started with your head to toe exam. So the first thing that we're gonna do is we're just gonna look, starting with your head, make sure everything's symmetrical, that your ears are symmetrical, your eyes, that your nose is midline. I'm just gonna feel your scalps for any lumps or bumps or irregularities. That feels good. I'm gonna feel your sinus cavities. Any pain there?
Yeah.
Okay. Good. Perfect. Were you having any other complaints?
No.
At the time? Okay. So we're gonna move along to a little neurological assessment. So what I want you to do is I want you to squeeze your eyes really tightly to test cranial nerve number 2. Good. Okay. And wrinkle your forehead. Perfect. And puff your cheeks out. Good. Now what I want you to do is push your tongue towards my hand and then over here on this one. Good. Everything feel normal?
Mm-hmm.
All right. Now what we're going to do is we're going to examine your eyes. So I'm going to feel your lacrimal glands. Everything feels normal. Have you been having any problems with your eyes?
No, not at all.
Okay. So what we're going to do is just examine them. I want you to look straight ahead, and I'm just going to look at your eyes directly. Great pupil reflex. Good. And now consensually. Look straight ahead. Good. Okay. So the next test we're going to do is the cover the eye test. So what I want you to do is cover one eye and look at me. Good. And now switch and cover the other eye. Very good. All right. Now we're going to move on to the ear exam. I'm just going to palpate the tops of your ears and make sure your ruffles are good. Feels nice. Your skin's nice and moist and intact. Okay. No ear pain or anything like that?
No.
Any trouble hearing?
No.
Okay. So what I'm going to do is I am going to look into your ears at your tympanic membrane and make sure everything is intact. And there it is. Nice light reflex. I can see all of your bones. There's no redness. The canal is clean. So that's good. And I'm going to check the other ear for the same thing. Once again, great reflex with the light. See your bone structure. No redness. Good job. Okay. So your ears look wonderful. Now we're going to check your nose. It's midline. Do you have any trouble breathing? Have you ever had any polyps or anything like that?
No.
Okay, the nose looks midline. I'm just going to look up your nostrils, make sure you don't have any polyps. It's pink and moist. There you go. Looks like you might have a deviated septum on this side. Have you been told that before?
No.
Okay, moving right along. Okay, so the next thing that we're going to do is I'm going to look into your mouth. Okay, so what I want you to do is open your mouth. I'm just checking your mouth, make sure it's nice and moist, your palate looks good. Stick out your tongue. Ah. Okay, and I'm going to check for any cancer, so go ahead and put your tongue to the left. And then the other left. And up. Very good. Okay. Now I'm going to check your cranial nerve number 9, your gag reflex. So go ahead and stick your tongue out. And, oh, the uvula moved up. Perfect. Your tonsils look great. No swelling,
Thank you.
edema, anything like that. Okay. Now we're going to test your hearing with the tuning fork. What I want you to do is tell me if you can hear this the same on both sides, okay?
Mm-hmm. Yeah.
Yes, okay. So the next thing I'm going to do is, what I want you to do is tell me when you can no longer hear it. I'm going to put it toward your mastoid bone.
Okay.
And we're going to do the same over here.
Okay.
Perfect. Same amount of time. Okay. Next thing we're going to do is a whisper test. I want you to repeat after me.
Mickey Mouse.
Nice.
A Minnie Mouse.
Very good. You have excellent hearing. Okay, now we're going to move along to examining the neck area. We're going to be examining the thyroid along with a lot of other things. The first thing we're going to do is test to make sure you have good range of motion. So I want you to take your ear to your shoulder. Not your shoulder to your ear to your shoulder. Okay, and then the other way. Any pain?
No.
Okay, chin to your shoulder.
No.
And chin to your shoulder. And chin to your chest. Very good. Okay, now I'm going to palpate your thyroid gland. What I want you to do is just swallow. Good. It's nice and soft. Next thing I'm going to do is I'm just going to be examining all your lymph nodes, your occipital, moving forward to your anterior clavicle, to your posterior clavicle. Good. No lumps or bumps. It's wonderful. Okay, so the next thing that we're going to do is we're going to be examining the chest area. So what I'm going to do is I'm going to have you undrape here. I'm just looking to make sure that everything looks symmetrical. The first thing that I'm going to do is listen to you. Go ahead and take a deep breath. I'm listening for any abnormalities, crackles, wheezes, rhonchi, rails. I want you to lean forward a little bit. I'm going to listen to your apical pulse. Very good. Your heart sounds very good. I'm just going to percuss it to make sure that it's the right size. Wonderful. Okay, the next thing that we're going to do is examine your lungs. So I'm going to take a listen from the back. I want you to take a deep breath. Good. And the front. Okay. Your lungs are very clear. You have no adventitious breath sounds at all. I want you to just kind of turn to the side a little bit here. I want you to say 99. Actually, turn a little more so the camera can see you. Go ahead and say 99.
99.
99.
99.
99.
99.
99.
99.
Now what I'm doing is I'm just measuring you here. So I want you to go ahead and take a deep breath and let it out. Good. Deep breath and let it out. So your expansion is the same on both sides, which is great. And I'm just going to percuss your kidneys. Any pain?
No.
Good. Okay. The next thing I'm going to do is, I'm going to turn so you is I'm just going to measure here between where the dullness starts and stops. So I'm going to percuss here. Perfect. I'm going to mark that spot. And then I'm going to start here. Perfect. So we're going to say about 2 centimeters, or 2 inches, which is perfect there. And then of course we would do the same on the other side. Okay, turn back around. Okay, the next thing we're going to do is the same thing with the 99. This time I'm going to be listening, and I want you to repeat those numbers again. Okay? Just going to undrape you.
99, 99, 99, 99, 99, 99.
Perfect. Everything is as expected. Okay, so we're going to have you go ahead and I'm going to check your jugular vein distension. Looking at you now, and as I have been inspecting you, it looks perfectly fine. What I'm going to do is have you lean back at a 45-degree angle, just so you're putting more pressure, and I'm going to make sure that you don't have any jugular vein distension. So just kind of hold yourself up there. Perfect. And I'm just going to examine your abdominals while I'm doing that, the muscles. Okay. And now I'm going to listen to your carotid arteries. What I want you to do is just take a deep breath and hold it. Nice. Actually going to listen with the bell. Take a deep breath and hold it. Good. I don't hear any swishing, which is nice and normal. Okay, so go ahead and lay down. We're going to move on to the abdominal exam. I'm going to undrape you if you're okay with that. Okay, so first we're going to obviously inspect the abdomen. It's nice and normal. The next thing we're going to do is listen to it. I'm going to be listening in all the quadrants to make sure you have good vowel sounds. You're having bowel movements on a regular basis?
Yes.
Good. Now I'm going to do some light palpation. It's going to be about 1 inch. Very light. Let me know if you have any pain. Any pain at all?
No.
Okay. The next part of the exam is deep palpation. This is where I'm going to be palpating your organs. So the liver should be able to be palpated. And I'm also going to try to palpate your spleen, which I should not be able to feel. Okay? Let me know if you have any discomfort. It's going to be much deeper and a lot more pressure. So this is your liver here. Any pain?
No.
Good. Now I can't palpate your spleen, but another way we can do it is to kind of move around over here. So good. You shouldn't have any enlarged spleen. Do you still have your spleen? Perfect. Okay, so the next thing we're going to do is we're going to percuss your liver. So I'm just basically going to do the same thing I did before, mark it and measure it to make sure that your liver is the normal size. Okay, same thing here. Perfect. Okay, So your liver looks great. The next thing I'm going to do while we have you laying down is just listen to the different arteries. Go ahead and keep your hands to your side. We're going to listen to your aortic artery, your kidneys, your femoral, and all that. So what I want you to do is just kind of take a deep breath. I'm going to listen with the bell. And hold your breath. I'm listening for any breweries or swishing, which I don't hear. Go ahead and breathe. And I'm going to listen for the kidneys. Go ahead and take a deep breath. Hold it. Good. And hold it. Okay, now we're going to the iliac. Hold it. Good. And the next is the femoral. Hold your breath. Perfect. No breweries, which is good because the swishing sound can mean that there are problems and all of your arteries sound very good and clean. Okay, so let's go ahead and help you up. Okay, the next thing that we're going to be doing is more of like a musculoskeletal exam. So if you want, you can go ahead and put your gown back on. Okay, so I'm just going to feel for some of your pulses. I'm just going to feel for your brachial pulse. Good. And your radial pulse. Excellent. Same on this side, brachial and radial. Excellent. Okay, now moving down towards the feet, I'm looking at the skin. Everything looks intact, no swelling, no signs of infection. I'm going to feel your dorsalis pedis pulse. Radial pulse. Good. And then, of course, we would do the same thing on this leg. Okay, now we're going to check your reflexes. The first one that we're going to check is here, the brachial reflex. Good. 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 Now we're going to check your knee reflex. Okay. The next one we're going to check is your Achilles tendon reflex. Good. Perfect. Okay. Now we're going to examine the spine. So what I'm going to need you to do is stand up nice and slow. Okay? I want you to go ahead and bend over. And I'm just checking the curvature of your back, making sure, put your head down, making sure everything is midline. Good. Now I want you to come up to about a 45-degree angle right there. And I'm just checking again. And once again, everything looks good. Okay? So you can go ahead and sit down. The last thing we're going to check is just your sensation on your face, since you didn't do that in the beginning. So what I want you to do is go ahead and close your eyes. And I want you to tell me if you feel soft pressure or sharp pressure.
Soft. Hard. Soft. Oh.
Okay, and the last one is keep your eyes closed. We're going to test your sense of smell. What do you smell?
Like alcohol.
Good. And on this side?
Alcohol.
Perfect. That was our alcohol wipe. Okay, and that concludes our exam for the day.
Okay?
Yes.
Oh, thank you.